So today I'll be talking about spondylolisthesis, which is a common condition. We see patients in the clinic often with the complaints of spondylolisthesis. So basically, what is spondylolisthesis? It is a forward translation of one vertebra on another in the sagittal plane of the spine. Okay, so as you can see in the diagram, if you trace the posterior border of the vertebra, this is L3, L4, L5, it ends here, whereas the S1 is here. So basically, the L5 have shifted forward over the S1 vertebra. So there is a spondylolisthesis. And this listhesis can either be in the anterior direction or sometimes it can be in the posterior direction. So if it is in anterior direction, we'll call it anterolisthesis. And if it is in posterior direction, we call it a retrolithiasis. Okay. But the common term for both of these is spondylolisthesis, which signifies a slip of one vertebra over the other. Whereas there's another term which is commonly used, spondylosis. Okay, so what is spondylosis? Basically, it is just a defect in the pars interarticularis of a lumbar vertebrae. So it's a defect which is you can say a predisposing factor for spondylolisthesis to occur. So lumbar spondylosis, you can say, is one stage earlier than lumbar spondylolisthesis. And again, it is most commonly due to repeated and increased stress on the pars interarticularis. Here you can see in the second diagram, okay, this is the defect in the pars interarticularis. Okay, there's a fracture, you can say, and because of this fracture, this anterior structure, the whole of it becomes free. Okay, and so the L5 can now easily slip over the S1 vertebra. Okay, so you can see that the anchor is broken. Okay, so pars, what is pars? Basically, pars is the region between the superior and the inferior articulating facet of the vertebrae. It is the weakest area in the neural arch. Okay, because a lot of force is coming here, and anatomically, it is a very thin piece of bone. Okay, if you see the articular facets above and below, or the spinous process, or the vertebral body, they are all very thick. Okay, but this pars interarticularis, the connection between the superior and the inferior articular surface, this is very thin, and that's why it is very much susceptible to stress, leading to a fracture. This pars defect, as it is called, is not observed in newborns or non-ambulatory patients. The lysis or elongation does not occur in primates that do not have an upright bipedal gait. Okay, so I mean the animals walking on four limbs, they do not experience this kind of condition. The presence of lumbar spondylosis, which is unique to humans, is necessary for the spondylolisthesis to occur. So basically, with evolution, the man has become a two-legged animal from a four-legged animal. And subsequently, there have been changes in the spine. Okay, there has been a thoracic kyphosis, which has been compensated by a lumbar lordosis. Okay, and because of this lumbar lordosis, because of this mechanical situation, there's a lot of stress on the pars. And as I told you, any undue stretch pressure on the pars can lead to a fracture, and which can lead to further slipping of the spine over the over the base. If you go into embryology and ossification center, this is just for the theory part. The pars ossifies at 12 to 13 weeks of gestation via enchondral ossification. The ossification center is in the region of the pars for a lumbar vertebrae. Uneven trabeculation and cortication can be seen. Ossification center that arises at the upper end of the pedicle, and it is uniform trabeculation throughout the pars. So basically, it's a potential stress riser which could be susceptible to a fatigue fracture. So it is also known as a stress fracture or a fatigue fracture. Now, coming on to the classification of spondylolisthesis, the most common classification followed was given by Wilson, Newman, and McNabb, and it was given in 1976. There are five types of spondylolisthesis. The first one is dysplastic, which is usually seen in children. So dysplastic, as the name suggests, there's a defect in the formation of the vertebrae, which leads to an early onset, or you can say a congenital form of spondylolisthesis. Then the type 2 is a ischemic type of listhesis, which is commonly seen between 5 to 50 years of individuals. Third one is a degenerative, which obviously seen in older patients. The fourth one is a traumatic type. So even a trauma or a fracture of the pars itself due to a high velocity trauma can lead to this kind of condition. And the fifth type is a pathological type. Pathological type basically means there's already an existing defect in the vertebral body or the surroundings, which leads to a slippage of one vertebrae over the other. We'll go into the details. So coming on to the first one, which is the dysplastic spondylolisthesis. The dysplasia or the aplasia of posterior facet joints of the L5S1 level and constant spina bifida occulta at L5 level, congenital in nature. As I told you, these defects are right from the birth. So the anatomy, the formation of the facet joint, okay, the junction between L5 S1, that is not well formed. There's a defect there which promotes this slipping of the vertebrae. And it leads to concomitant elongation of the pars interarticularis and finally leading on to a frank lysis. A frank breakage or the fracture is there and followed by a slippage of the vertebrae. This condition is strongly familial with as many as 1/3 of first degree relatives affected by the dysplastic form. Okay, so you can see there's a high probability that if one person is having a dysplastic spondylolisthesis, his subsequent generations will also be having it. Here you can see this is called the dysplastic type. Okay, I mark the area. So you can see L5 has slipped over the S1 because have been a rounding of the top of the sacrum and the L5 has rolled over anteriorly due to a poor formation, poorly formed posterior facet joint. So basically, the rounding of the vertebra is promoting a slip, and since the facet joints are poorly formed, they are not holding it back, the slippage becomes imminent. In the AP view here, you can see as I have marked it, there's a Napoleon hat. Okay, this is because of the spina bifida. The laminae fail to meet or ossify in the midline, so giving this kind of defect. It is also Napoleon hat. Okay, can you see? Can you visualize it? Okay, so this is the Napoleon hat. Okay. Coming on to the second one, it is the isthmic spondylolisthesis. Okay, and there's a repetitive cyclical extension torsion of the spine, a repetitive intrafaction fatigue failure of the pars. So basically, this is due to repetitive, stress on that area, on the isthmus. And this type has a high prevalence rate. It has the highest biomechanical forces on the pars at L5S1 level. Okay. And the commonest site, and it is the commonest site of a lytic spondylosis. So basically, the isthmus, as I told you, that is the junction between the superior and the inferior articular facet. That is the weakest point, and this, due to repetitive stress, this part's given, leading to a frank spondylolisthesis. Here you can see. Okay, can you appreciate that? This sign is also called something Scottish dog terrier sign. Okay, so if you can appreciate that, the one in the circle, if you assume this is the face of the dog, the ear, this is the neck. Okay, so there's a break in the neck of the dog, and this you can visualize as a body of the dog. Okay, so this appears like a dog on an oblique view, and you can see a lytic spondylolisthesis. Lysis has taken place, a fracture has taken place. Here in the first one, you can it is a dead lateral view. You can appreciate the break much more. Okay, the slip is much more.